All right, good morning, everybody. Thank you for joining us. Welcome to the SEBS Virtual Science Cafe. Don Schaffner will present on understanding and managing the risk of COVID-19. My name is Brian McGonigal. I am the Manager of Alumni Community Engagement for the School of Environmental and Biological Sciences, as well as the New Jersey Agricultural Experiment Station. I just want to go over a few ground rules. Attendee microphones will remain muted during the presentation. Please use the chat feature to submit any questions you may have. If there is a follow-up question, we will be able to unmute you. And this event will be recorded and posted for subsequent viewing. Okay. So. All right. At this time, I would like to introduce Mary Nucci. She is the director of the Science Cafe program. Mary, take it away.
Thank you, Brian, and thank you to everyone for joining us today for the second of what is a series of 3 Science Cafes this semester, and we'll continue in the spring. So it's my pleasure to introduce our speaker today. I've had the great fortune to know Don for several years now, and Dr. Schaffner is a distinguished professor in the food science department at Rutgers University. His research interests include hand washing, which should be everybody's interest right now, cross-contamination, and quantitative microbial risk assessment. We're very lucky to have Dr. Schaffner here. He is well honored. He's a fellow of the Institute of Food Technologists, the American Academy of Microbiology, and the International Association for Food Protection. He was the president of the International Association for Food Protection in 2013 and 2014. In his spare time, Dr. Schaffner co-hosts the Food Safety Talk and Risk You're Not podcast, and we'll give you information about those at the end of the event today. And one of the things that has taken up a lot of his time lately since the start of the pandemic is being interviewed by TV and print media, such as the New York Times, the Washington Post, and Wall Street Journal on the SARS-CoV-2 and the risk of COVID-19. And he will be talking to you about that today. So thank you, Don, for joining us, and I'll hand it over to you.
Thanks, Mary. I really appreciate the chance to come here today and to speak, to be part of the Science Cafe. So what I'm going to do, and well, first let me ask Brian to go ahead and get the slides up. But what I'm going to do today is to kind of walk through what my experience has been in the pandemic. And so I've given myself the title of Understanding and Managing the Risk of COVID-19, but with a subtitle, because I come to this not as an infectious disease expert or a virologist, but a simple food microbiologist. And so I've given myself the subtitle, A Food Microbiologist Thinks About COVID-19. And so what I will do in the next 45 minutes or so is to give you some musings and to give you my perspective on the pandemic from the perspective of food microbiology. Next slide, please. So you might be asking yourself, what does a food microbiologist actually know about SARS-CoV-2 or COVID-19? And the answer is, at the beginning, I didn't know very much, but I did have a couple of very strong bases to build from in terms of my knowledge. So I've been at Rutgers more than 30 years. In that time, we've done research using math and statistics to try to predict and understand the behavior of foodborne pathogens. And then probably in the last 20 years or so, that risk has focused specifically on microbiological risk assessment. So what are the specific risks of certain pathogens in certain foods being held under certain conditions? And so I'm used to thinking about microorganisms. I'm used to thinking about risk and how you quantify and how you express and how you mathematically model risk. Also, in the last 20 years or so, we've gotten very interested in hand washing and the effectiveness, specifically quantifying the effectiveness of hand washing. And then as part of that, understanding cross-contamination. So from a food microbiology perspective, if I cut up the raw chicken and then I wash my hands, but I touch my hands to the taps on the faucet, and then I wash my hands, and I take my clean hands and I touch those dirty taps. What's the probability that I'm going to end up with some salmonella back on my hands again? So that was some of the first research that we started doing. We've kind of built from there. So I'm used to thinking about those kinds of risks. So that made a really nice starting point to kind of build my knowledge of SARS-CoV-2 and COVID-19. But maybe a better question is, as a food microbiologist, why would I care about SARS-CoV-2 and COVID-19? Well, my title is in part Extension Specialist in Food Science, and so what that means is that part of my job is talking with the general public about risk, and lo and behold, people, and I'll tell you more about this in just a few minutes. People were very concerned about the possibility that they could contract the virus. They could get the virus and contract the disease from food or from takeout. Or from the packaging in their takeout, or from the foods in the grocery store. And so I was getting a lot of questions fairly early on about these subjects. And so I needed to educate myself so that I could try to answer people's questions. And I would say that this resulted in just a ton of news media. Unfortunately, things have kind of settled down a little bit, although there's a paper that just came out the other day on talking about virus survival, building on some previous work that I'm going to actually tell you a little bit about today. And so I've been really, really busy, again, sort of describing it as trying to drink from a fire hose. Prior to the pandemic, I would say that my previous experience with this kind of level of contact from the media was when we published a paper a couple of years ago on the 5-second rule. Boy, people really have opinions about the 5-second rule. So I've really been doing a lot of news media, like I said, since the pandemic started. Although it's tapering off a little bit these days, with occasional spikes when we have a particularly newsworthy topic. Next slide, please. So part of my experience with the pandemic has been using social media to comment on various aspects. And so, and I'm not going to talk about all of these, but this gives you some idea of basically how I spent the second half of March and much of April, tweeting about hand sanitizer, the merits of Lysoling your takeout, whether you should use soap to wash your produce. Spoiler alert, don't do that. How you should sanitize your groceries after you bring them in from the grocery store. Understanding how the virus survives on surfaces, understanding how the virus is transmitted, the virtues of using disinfectant wipes, and then even eventually at the end getting into a discussion around face masks, which again continue to be a perennial topic. And again, I'm not going to talk about all of these, but I'll talk about a few of them in the next few slides. Next slide, please. So this was my first foray into talking about this on the internet. I'm a bit of a computer nerd. There's a wonderful website if you're interested in things that are technological, especially Apple and Apple's products. There's a wonderful website called Daring Fireball, and it's run by a blogger named John Gruber, who's quite an interesting and fun guy. He nominally blogs about technology, but he's not afraid to foray into politics or public health or things that interest him. It's his own blog, and he kind of does what he wants, which I really admire. So he had a post about the science of soap and how it kills coronavirus, which basically picked up a story from the Guardian UK newspaper, which was basically commenting on some hot takes on the virus by a physical chemist who explained in his article that basically if you expose the virus to soap, it just pops open the virus and it kills the virus. And again, having done some research with hand washing and hand sanitizers, and again, one of the things that this particular person was saying was, well, you should not use hand sanitizer because again, if you use soap, it just pops the virus, right? And that didn't quite make sense with me, and I wanted to kind of dig. I like to say things on the internet that are true or that I can at least back up with science, and I really couldn't find any real strong concrete evidence that using soap would pop open the virus. I mean, this was this person's mental model from his perspective as a physical chemist and understanding how soap works, but I really couldn't see any real evidence for this in the scientific literature. So I wrote a nice 15 tweet thread, and then got a little bit of replay. Talked to a bunch of friends of John Gruber to try to get him to say, hey, look, maybe this article is not quite as true as you think it is, and actually eventually did get word to him, and John reached out to me, and I was hoping for him to post a modification to the story, but instead he linked to my original tweet thread, which was very kind, and got some exposure, and hopefully got some people educated about what actually soap does, which is to physically remove the virus from your hands. It can be used in conjunction with sanitizers, but there's no reason to bash sanitizers because soap is not magic. Next slide, please. This is a question again from another nerd friend on the internet, a guy by the name of Lex Friedman, who is a podcaster and a blogger, and now works in the podcast space. And he says, hey, you're not worried about the food being contaminated by the kitchen staff. What about hot food? Is hot food less risky than cold food? And again, my particular hot take on this was, well, at this point, and this is mid-March, we really didn't have any evidence that the virus was being spread by food. And I would say as of today, middle of October, we still have no evidence that the virus is being spread by food or food packaging. That doesn't mean that if you test food packaging, you can't find the virus. We've seen some news stories coming out of China, where China has this massive testing program looking at food packaging, especially frozen food packaging. And lo and behold, if you test the packaging, you find viral RNA. But just because you find viral RNA doesn't necessarily mean that you have live virus. I'll talk about that in just a few minutes. And so, again, here it is, still the middle of March, and I'm tweeting a 10 tweet thread on takeout and the risks around takeout. My bottom line on this is, if you're worried about getting the virus from takeout, you should just wash your hands or use hand sanitizer after you've unpacked everything and before you sit down to eat, which was probably a good idea before the pandemic as well. So, washing your hands before you eat is probably always going to be a good idea. Next slide, please. Here is one that, again, we spent some time kind of fighting misinformation. There are a bunch of people out there on the internet saying, hey, if you're worried about the virus being on your food, you should wash your food with soap, because we know soap is great for hands, and soap works for food too. Well, it may work for food, but soap is actually not designed for use on food. Those of you who work in the research lab, you may have heard of something called a material safety data sheet. You can go out there and look for material safety data sheets on soap, and what you'll find is that you should not consume soap. You should not drink soap. You should not drink soapy dishwater. You should not eat soap residue on foods. And so again, if you want to wash your produce, I suggest using cold water. If it's got a firm skin, you can scrub it with a scrub brush. If you're really concerned and you've got the disposable income, you can buy some produce safe produce washes in the grocery store. I'm not sure they really do anything, but at least they're not soap, and so they won't give you a stomach upset. And so yeah, good idea to use soap for washing your hands, not so good for using it on your fresh produce. Next slide, please. So this one kind of took off. This is a 33 tweet thread. As you'll see there on the slide, this one got about 9,000 retweets and 14,000 likes. And this one, and 458 people felt compelled to respond to me and offer me their opinion on my hot takes. So this was, you may have seen this video. It was a medical doctor. He's I think a family physician, but he was dressed all in scrubs, because everybody knows that, if you're a doctor, you got to wear scrubs. And he proceeded to make this viral YouTube video, which showed that how you had to disinfect your groceries after you got back from the grocery store. And he shows using disinfectant and spraying the groceries and using aseptic technique. And I just thought to myself, that just seems like a whole lot of nonsense, especially, and this is again still late March now, and still no evidence the virus is transmitted by food or food packaging. And again, I was very gratified. Well, so of course, you know, a lot of visibility on the internet. There were plenty of people telling me, how dare I suggest that they should not do this, that they felt they were very at risk, and they were very angry that I was telling them they didn't have to do this. I would say in equal measure, or perhaps even in greater measure, I had a number of people saying, thank you so much for telling me that this is not necessarily a good idea, or that I didn't have to do this, because I tried to do it after seeing the video and coming back from the grocery store, and I had a panic attack, or I almost had a panic attack, or it made me so worried that I wasn't doing it right, that I wasn't just completely, fully disinfecting all my groceries. So I had a number of people reach out and say, hey, thanks, that was really helpful for, you know, calming my panic about this. And so, yeah, and then this has continued to get a fair bit of visibility. And occasionally I do hear people talking about it and responding. But again, hopefully, and again, I think after a number of people criticized his video, the doctor did change it. I think he was also recommending using soap to wash your produce, which again is really just not a very good idea. So next slide, please. Okay. Oh, and this is kind of confirmation, perhaps, that using excessive amount of cleaners or excessive amount of disinfectants is not necessarily a good idea. This is a paper that was published in Morbidity and Mortality Weekly Reports. It was published, it covers the time period of January to the end of March, but it came out, I think, I don't have the date on here, but I think it came out within the last couple of months. But basically, what we see here, and again, it's a little bit small on the slide, but you can see that dark black line. That is the calls to poison control centers for people being exposed to cleaners or disinfectants. And what you can see is, starting around the beginning of March, you see a significant uptick from the year 2020, which does not track at all the seasonality that you see in 2018 or 2019. And so basically it's showing that the calls to poison control centers are fairly constant over that January to April timeframe, except for 2020. And again, I would encourage you to take a look at this MMWR article. It has a couple of case histories of people that got rather sick from being exposed to cleaners or disinfectants. And so kind of reiterated the point that I was trying to make. You know, if you have someone who is sick in your home with COVID-19, it's a good idea to disinfect and to be safe in ways that the CDC has provided guidance on. But if you're not ill with COVID, if there's no one sick with the disease in your home, you probably don't need to be spraying everything down with bleach every 5 minutes. That's probably an overreaction. And so again, it was heartening to see. You know, I'm sorry all these people got sick, but it was heartening to me to see that in fact there are risks from using this excess level of cleaning and sanitizing that is probably out of proportion to the actual risk posed by the virus. Next slide, please. Another thing that a lot of people were doing, and I still continue to get questions about this, is how long to keep your food packages undisturbed to inactivate the virus. People were also talking about, you know, I heard that it lasts for 3 days, so I've been quarantining my mail for 3 days. And again, that's probably not necessarily a practical risk reduction. Certainly, if you are concerned about getting the virus on mail or on food packages, it's a good idea to wash your hands after opening the mail or after going grocery shopping. You know, those are all still good things to do, but I don't think that you need to worry too much about keeping your food packages in the garage for an excessive period of time to inactivate the virus. Go ahead, next slide, please. So and now we're going to sort of segue into the science, talking about some of the science that other people have done. So that raises an interesting question. How long does the virus actually survive on surfaces? Well, one of the first bits of evidence we had came from this MMWR article published on March 23rd. And this says that 17 days after cabins were vacated on the Diamond Princess, but before disinfection had been conducted, we found the RNA from the virus. And so I want to make a point that just because you find RNA from the virus doesn't mean that you have infectious virus, okay? But for a long time, people were saying, oh, the virus lasts for 17 days, right? So it lasts for a really long time. What we don't know, and you can see from the little screenshot that I posted here, you see the name of the person, you see their affiliation, and you see that it was a personal communication. We still to this day, as far as I know, we don't know what methods were used to produce this positive result. I'm assuming it was PCR, polymerase chain reaction, where you basically isolate the viral RNA and then you turn it into DNA, complementary DNA, and then you amplify that DNA until you find a detectable signal. So, so probably it was based on PCR. It might be a false positive. There's something called a CT value, which stands for cycle threshold. That's basically the number of times that you had to cycle through the PCR reaction to double the quantity of nucleic acid. And so the higher the CT value, the more amplifications you had to do. And what we found is that if you amplify anything enough, you'll get a positive signal just essentially by accident. And so we don't know the CT value. We don't know if it was a false positive. But my suspicion is this was either was a false positive, or it was just a very low level of viral RNA, and it did not equate with infectious virus. But of course, we probably will never know. But certainly to say the virus lasts for 17 days is perhaps not entirely correct. Next slide, please. Now, this is a nice article that came out, I believe, in the New England Journal of Medicine. And this is a lot better because what they're saying here is, well, first of all, they're not using a PCR-based method. They're measuring something called TCID 50. So TCID stands for tissue culture infectious dose. And then the 50 means the dose needed to cause 50% of the tissue culture cells that you try to infect at that concentration. And so what you can see, and again, it expresses this data as a half-life, and that's a very useful thing. And so what does it mean to say the virus has a half-life of 7 hours? So what that means is that if you start with 100 virus particles at time equals 0, after 7 hours, you'll have 50 virus particles. And then after another 7 hours, you'll have 25 virus particles. And then you'll have 12 and a half virus particles. We don't need to talk about what a half a virus particle is right now. But basically, the idea is that every 7 hours, the level of virus drops by 50%. And that also means the risk drops by 50%. And so really, it's not about how long it lasts. It's about the rate of decline. Next slide, please. So this slide makes that point a little bit more clearly. Like I said, it's not about the time. It's really about the starting level, and it's about the limit of detection. And so you can see here, this is some data on SARS-CoV-2 on plastic from the same article. And you can see as a starting level, they used about 10 to the 3 or 10 to the 4 TCID 50 virus particles. And so so depending on the starting level, and then depending upon the limit of detection, and on this particular slide, the limit of detection is shown by that dotted line across the bottom, that will tell you how many hours it survives. And so you can see that it survives about 72 hours, but that is dependent on the sensitivity of the method, and it's dependent upon how many virus particles you start with. And so really, it's much more relevant to say it's about the rate of reduction, right? And so again, talking about the viral half-life, how long does it take to go from 1,000 virus particles to 500 to 250 to 125, et cetera? And so you can express this as a half-life. As a food microbiologist, we're very commonly talking about things like this in terms of decimal log reductions. And so instead of the time to drop by 50%, we talk about the time to drop by 90%. But basically, you can interconvert between those two things. And then I have a question there. What is 1/10 of a virus? Well, it's not 1/10 of a virus. What it means is that if you had a probability of 1/10 of a virus on 10 different surfaces, you probably have one of those 10 surfaces that's positive. So again, it's not about how long the virus survives. It's really about the rate of reduction, where in a given period of time, that probability of having an infectious virus is going to drop by 50% or 90%, depending upon the measure that you're choosing. Next slide. So this slide is entitled "The Friends You've Made Along the Way." This is a wonderful article, opinion piece that was published in The Lancet, and it was published by a professor at Rutgers University, Rutgers Newark, named Emmanuel Goldman. I did not know Professor Goldman at the time he wrote this article, but it did kind of strike a chord with me, because what he lays out here in this opinion piece is basically the fact that there does seem to be an exaggerated risk of transmission by fomites, at least as it's expressed by maybe the advice people are giving or that we see promulgated in the news media. And it's very much in line with my own thoughts on the subject. And again, the absence of evidence of transmission from surfaces, as near as we can tell, or very rare transmission from surfaces. And so I reached out to Dr. Goldman, and we've now become internet friends. And in fact, we were even now maybe potentially collaborating on a research project. And so we had our first Zoom call. So we got to actually see each other, not quite in real life, but almost in real life. And so again, it's been fun to meet people and to discuss this. And like I said, it's the friends you made along the way. Next slide, please. So thanks to meeting Professor Goldman, when Derek Thompson, who's a reporter for The Atlantic, reached out to him to write an article with a very provocative title, "Hygiene Theater is a Huge Waste of Time." Derek also reached out to me, and here's a soundbite that appeared, or a quote that appeared in that Atlantic article. "In the entire peer-reviewed COVID-19 literature, I found maybe one truly plausible report in Singapore of fomite transmission, and even there, it's not a slam dunk case." And so we are continuing to see occasional evidence of the transmission of the virus from surfaces. But again, overwhelmingly, the way people get the virus is being around other people indoors for extended periods of time where people are not wearing masks. And so while I certainly still believe in washing your hands, and I certainly still believe in, keeping your house clean and, clean your counters, especially after you've chopped up some chicken and there might be salmonella there. What I really want to make clear to people is that the true risk comes from other people, again, indoors for extended periods of time when you're not wearing a mask. And so focus on those things first, and then maybe think about washing your hands and disinfecting surfaces. But to think that by disinfecting surfaces, you're going to keep yourself safe from a person who's breathing the virus into your face is just ludicrous. And so I want people to focus on the higher risks first before they focus on the lower risks. Next slide, please. What is that one case of fomite transmission? This is a really interesting article that was published relatively a little while ago now. But what I want to point out to you, this was published in The Lancet in March, on March 28th. And so this is typical for these transmission tracking, tracing type of studies. And so what happened was that two individuals, which are designated as C1 and C3, on January 19th, they came from Wuhan, China, which is, again, we think is the epicenter of the virus. They came from Wuhan, China. They obviously had been infected by the virus, but they were not yet symptomatic. They went to a church service in Singapore on January 19th. At that church, they exposed a number of other people to the virus. And then these two individuals, C1 and C2, they got sick 2 and looks like about 5 days, 3 and 5 days after visiting that church. So they were in the church. They were obviously shedding the virus, but they were asymptomatic. They didn't get sick until a couple of days later. Now the individuals listed here, C3 and C4, these are people that may have contacted C1 and C2 at the church. But what I want to talk about is C5. Now, C5 did not go to the same church service as C1 and C2. C5 did go to a prayer meeting that was after the morning service that was attended by C1 and C2. We know from CCTV footage in the church that C5 sat in the same seat, in the same location as C1 and C2. And so again, we don't know how long C5 sat there. We know that the morning from the paper, we know that the morning church service was 2 hours long. We don't know the intervening time period, but obviously this does seem to be a case of surface transmission. And so obviously C1 and C2, they're shedding the virus, maybe touching their face, touching the areas around the seating area in the church, and then this individual C5 comes in a little while later and then touches the same surfaces, and again maybe touches their face, and then ends up getting the virus several days after that church service. So it's like almost 14 days, right? So quite a few days after the church service. Next slide, please. So we've moved from me engaging with social media to engaging with people who are writing opinion pieces to actually now publishing papers. And so this is a wonderful paper that was published in Applied and Environmental Microbiology. The lead author is Laurent Guillier, who is a French colleague. He reached out to me to review an early copy of this paper. I was very interested because, again, this comes down to, what is the risk from surfaces and understanding that. The unique wrinkle of this paper is that we gathered data from the scientific literature over a wide variety of temperatures, and we looked at relative humidities where those were available, and then we also looked at whether these were studies that were done on surfaces or were done in liquid suspension, and basically collected all that information and put it into some computer models, and were able to get it fast-tracked and get it published in Applied and Environmental Microbiology. Next slide, please. This is the table, or the figure rather, one of the figures from this manuscript, and I love this. A huge shout out to my French colleagues for being so skilled with color and graphs. These are a variety of coronaviruses, not just SARS-CoV-2. You can see the original SARS virus as well as a bunch of other enveloped viruses, and we looked at the range of temperatures, and we looked at things that were on both liquids and surfaces, and I love doing this kind of work, and where you can kind of stand back and see the big picture. So what this shows is definitely there's a temperature trend. It's linear over short ranges of temperature, but over longer ranges it's definitely curving. And then basically we see that all of these viruses, there's some variability, right? They vary by orders of magnitude, but only just. And so this is just a really nice way to kind of get a general overall sense of the behavior of these viruses as a function of temperature. And so it was a lot of fun to collaborate with my French colleagues and begin to contribute to the literature and our understanding of this virus and of related viruses. Next slide, please. So let's advance the story even further. So while all of this is going on and people are worried about Lysoling their takeout and what are the risks from restaurants and when should we reopen restaurants and what about indoor dining versus outdoor dining? Apologies, I'm working from home and my dog sees something that she's not happy about. Stop it. So I collaborated with a colleague. One second. Out. Yeah. I collaborated with a colleague, Ben Chapman, at North Carolina State University, and we actually got some funding from USDA. This is funding for a project called Food COVID Net, and Food COVID Net is a collaborative approach to managing SARS-CoV-2 within the food industry. And the objective here was to fill data gaps, to answer questions that were being posed to us by our industry colleagues, to fill data gaps and then ultimately impact the behavior of people working in the food supply to keep the food supply and the food workers safe. With that, let's go to the next slide. So I want to just briefly talk about some of the things. Sorry, I'm going to have to kick her out of the room. Okay, so we have 5 objectives of this grant proposal. The first one is to basically take this fire hose of information that's coming to us about the virus and find ways to catalog, collate, review, and then sort of distill that information down to information that the food industry wants to know, and to try to do that as rapidly as possible. Of course, as we're doing this, we're going to also continue to identify knowledge gaps. So what information does the food industry need that's not being currently developed by the rapidly expanding literature, and then hopefully either talk to people about doing that or do that work ourselves. There is a research component to this, and again, I'm pleased to say that we're going to be working on this. We're not going to be working with SARS-CoV-2, but we are going to be working with an envelope viral surrogate, a bacteriophage. That's a virus that infects bacteria called 5-6, and so this organism infects Pseudomonas bacteria, but we think it might be a good low risk way to study the behavior of this high risk virus, and hopefully the data that we collect will help people that are going to work with more risky viruses. But our work with this surrogate will hopefully blaze a path that will help them design fewer but better experiments. So we'll be doing that, and again, we'll be working over the next couple of years to do all of this. And then fourth, take the information that we're collecting from our own work and translate all of that into evidence-based best practices that are truly based on science, that really help to really characterize and then manage risk. And then, of course, finally, we want to document that we're actually doing some good and we're actually helping people in the food industry to manage risk. Next slide, please. I want to talk just a little bit more about the work that we're doing with these viruses. And again, I liken it to a pyramid. We're going to base that pyramid based on the research that we'll do in my lab, as well as other labs around the country, working with this bacteriophage 5-6. Turns out it's a little bit tricky to culture, but we think we figured it out thanks to some feedback from some colleagues with more experience. And so the idea is to use this bacteriophage to study survival, but also to study cross-contamination. Because again, one of the things that we know is that if it's true that fomites represent a low risk, one of the reasons why might be that you don't see very much transfer. So you have the virus on a surface, you touch that surface with your finger, how many viral particles move from the surface to your finger? Based on prior research with other organisms, my scientific answer would be not many, but of course that's going to be dependent on how hard you press and whether your finger is wet and maybe the nature of the surface, et cetera. So we're going to begin to investigate some of that. And then after we kind of figure out how the bacteriophage behaves, we're going to see whether that can be used to guide further experiments that need to be done at the biosafety level 2 level. And there are a number of other mammalian viruses that are not SARS-CoV-2, including influenza virus and rhinovirus, as well as some other different types of viruses that infect mammalian cells, and then use those data to further refine the experiments. And then finally, once we kind of think that we understand the similarities and the differences, finally go on and do some work, which is, again, very, very limited number of experiments, fairly costly to do, but finally go on and do some work at the biosafety level 3 level, which is the level you have to be at to work with the SARS-CoV-2 virus itself. And so the idea is that we'll sort of start with this very safe virus, we'll build to more risky viruses, and then finally, hopefully by then, have all the kind of the experimental parameters worked out so we can really truly validate whether any of this is relevant to SARS-CoV-2. And again, we hope that it will be, but at that point, we'll have very focused experiments that we need to do. Next slide, please. So that brings us to the end of my talk. I think this pandemic has been it's been devastating for people. It's been very disruptive, but it's also been an opportunity to really expand our knowledge. And so I've been pleased to be able to contribute so far. I really, again, I mentioned before that we've done research for 20 years on microbial risk assessment and risk management, and now we have the opportunity to do that with SARS-CoV-2. And so ultimately, my goal here is to do quantitative microbial risk assessment for conditions that are relevant to the food industry. We've seen a number of devastating outbreaks in meat packing plants. We don't know why meat packing plants seem to be so risky. I suspect it has something to do with the cold temperature conditions that you need for food safety. They may also promote viral survival. I suspect it has something to do with the fact that the people that are working in those meatpacking plants are doing hard physical labor. So they're breathing heavily. They're breathing out the virus. They're breathing in the virus. We've seen a number of these super spreader events at choir practice, which is another indoor activity that takes place, not quite as cold, hopefully, where people are breathing in and breathing out. And we've seen large numbers of people become infected at these kind of events. And so I think there's some aspect to the meatpacking work, because it's also hard physical labor where people are really taking deep breaths that's leading to the spread of the virus. And there might be other risk factors associated with meatpacking plants as well. And so it would be great to know that, right? It would also be great to know what's the risk of walking through a grocery store. And again, we know that masks can help to reduce the risk, but trying to come up with quantitative data that will help us actually assess that and manage that is going to be really important. So as it's implied here, I think there's a bright future for microbial risk assessment. I think ultimately we are going to get through this pandemic. I'm not a vaccine expert, but I'm very encouraged by what I hear about vaccine development. The advances in terms of treatment of the disease have been really impressive. We've again, any one death is too many, but we are getting better at treating the disease, and the death rate per diagnosed case is down. I think in part because we've been able to figure out some techniques and some things that work to try to help people get through this. But again, it's still a devastating disease. There's a whole class of people out there called long haulers that experience symptoms well beyond the normal disease course. And so understanding what's causing that and helping those folks is important as well. But with all of that doom and gloom, I would say I think the future is relatively bright with respect to this pandemic. We've learned a lot. We're going to continue to learn a lot and hopefully use that information to ensure that the food supply remains safe, and also ensure that the food supply remains a food supply. Food workers are essential workers. This pandemic would have been devastating if we, in addition to fighting the virus, if we if we couldn't find food to eat. And so it's very important that we keep the food supply and the workers that work in the food supply healthy, so that we can continue to all have food as many of us shelter in our homes as we wait for the pandemic to subside. So with that, let's go to my last slide, which is just a prompt for questions. So with that, I would be happy to answer any questions as long as we have time.
Okay, Don, this is Mary. You have a bunch of questions here from our attendees, ranging from the very scientific to kind of the more general. So the first one is more scientific, that says latest Australian data shows 28 days survival of virus. Don't know what that means in terms of how many replicable virus particles survive. Maybe measurable, but not risky enough is the question.
Yeah, so actually, I'm familiar with that article. We actually did some, that came out after I wrote my slides. I probably need to amend my slides for future talks. One important thing to remember about that, as I said before, it's not about the number of days, right? It's about the survival rate. And one thing that they did in that experiment is they used a starting concentration that was 100-fold higher than the previous work that I talked about. And so one thing that's going to get you to 28 days is to use that higher starting concentration. Another thing that they did in that paper is they studied several different temperatures, which again is kind of a callback to the work that we published. And so as you lower the temperature, and I think the lowest temperature in that Australian paper was 20 degrees C, which is a little bit below room temperature, which we generally figure is about 25 degrees C, but that lower temperature will extend viral survival. And then the other thing to remember in that Australian paper is they also incubated their samples in the dark. And we know that, again, we think that being out of doors reduces viral transfer. That may be because of airflow patterns, but it may also be because of UV light, which we know the virus is susceptible to. And so another explanation for the longer times reported, or the longer half-lives reported by those authors, is the fact that they were very careful to store their samples in the dark because the virus is sensitive to inactivation by UV light. And so certainly that's it. Oh, and then the other thing I would add as well, and this is something that, again, I only learned about because of somebody emailing my colleague, Dr. Goldman, it's also important to realize that when the virus is expelled into the atmosphere from an infected person, it's typically in a droplet of mucus. And there are things in mucus that are antiviral. Now, when people do research like the Australian people did, they make a fake mucus that has the properties of mucus, right? But doesn't contain those antiviral, antibacterial components. And so another factor, which may explain the good survival they get in the Australian paper, is that they are studying it under these artificial conditions with not in natural mucus. Now, and that's easy for me to say. It's another thing to actually get actual real mucus to study the virus, and that may make things a little bit more complicated. But again, there's a lot of things that we have to think about. So I think that paper, it's a good paper. They did use TCID50, right? So at least they were measuring infectious virus particles and not RNA. But it's important. It's another piece of information that we're going to need to consider as we move forward with trying to manage risk. But it hasn't really changed my overall opinion that much.
Sorry about that. Next question is, we're going to go different direction here. I'm looking to balance doable and practical with what is most effective. I weigh the risk of my activities with the likeliness of catching it. What specific behaviors can you suggest?
Yeah, so I mentioned it earlier in my talk, and try to mention it in every media interview I do. So remember that the way you get the virus is from people. So number one, stay away from people, okay? If you can't stay away from people, you should wear a mask when you're around people. And ideally, if you're going to be around people, try to do it outdoors. There does seem to be a risk reduction from being outdoors. So, and maybe that's because of airflow and ventilation. Maybe it's because of UV. Maybe it's because of both. So definitely be outdoors. And if you have to be around people and you have to be indoors, then absolutely positively be sure to wear a mask. And then somewhere further down on the hierarchy, I would say, remember to wash your hands, use hand sanitizer. It's not necessary to wash your hands like all day, every day, right? That could be problematic. That could be an indication of OCD. And again, if you're experiencing symptoms of OCD, I would encourage you to talk to a mental health professional. It's a real problem people do suffer from, and there's no shame in it. But you should get some medical help with that. Yeah, and I would say again, don't go crazy disinfecting your house. As long as there's nobody in your house that's sick with COVID-19, just your normal cleaning regimes should be fine. So that's kind of the way I prioritize it. So start with people, and then outdoors, and then masks, and then hand washing and hand sanitizer use, and then cleaning of surfaces. That's the way I prioritize it.
Thanks, Don. I think that's an answer that a lot of people are really interested in. Next question is, would it be possible for COVID-19 to mutate to become deadlier towards younger people like the Spanish flu did in its second wave? If it were to mutate,
Yeah.
would contagion be reduced? And why is the COVID incubation time so long?
There's a bunch of questions there. So the incubation time is variable, right? Like you may get it. You could get it as long as 14 days after exposure, but it might be as short as only a couple of days. With respect to the virus mutating, I would say that every organism continues to evolve, right? And again, if a virus that is deadly to its host, that's not a very good virus, right? If you kill your host too quickly, you don't have the opportunity to spread. And so what the virus would like, if we can anthropomorphize a little bit, what the virus would really like would be to have very little effect on the host so that it can spread widely and get everywhere, right? And so I've seen some speculation by virologists who are much more expert than I say that if the virus does anything, it may actually become less harmful and may become more. So we have the common cold coronaviruses that now just give us a cold, and so there's been some suggestion that eventually this particular virus may change to become more like the common cold virus that will just give us a mild cold, and then we'll go on about our day. Again, there's still a lot we don't know. And of course, we only time will tell. Hopefully, we'll have a vaccine before very long, and that will help. But yeah, I mean, it's there's a lot we don't know.
Okay, Don, this question is, do you know the inactivation kinetics, the d-value of this virus at different temperatures in water?
What I would say is take a look at the Applied and Environmental Microbiology paper. We have a model that's published in that paper. It's a spreadsheet you can download, and you can plug in whatever temperature you want, and whether you're in solution or on a surface, and then that will give you a prediction for the d-value with the associated confidence intervals. So I encourage people to take a look at that. I believe that is a free download, and and the supplemental spreadsheet is also free. So should be able to do that to make some predictions.
Okay, this is a communication question, and it is, Twitter has been a prominent platform this year in relaying constant science information regarding COVID-19. Seeing that you, a scientist, has used Twitter to critique, respond to other scientific information, can you talk to the idea of this platform being utilized as a valid source for science information from reputable or credible users in the future?
Yeah, so the great thing about Twitter is that you can find a lot of information there. And the terrible thing about Twitter is you can find a lot of information there. So what I would encourage you to do is, well, I mean, so you like, it's like a tool, right? It's like any tool. And the latest thing we hear about Twitter is people are doom scrolling, right? Which is the idea of looking at Twitter and feeling worse and worse, and you just keep going and just keep feeling worse and worse. So hopefully that will get better later in this year. But yeah, I mean, yes, absolutely. I've found some great people on Twitter that have good information, and there's a lot of people that are spouting misinformation. And so unfortunately, you have to kind of look at the source, right? And so I would say if it's an anonymous account, I would treat it with some skepticism. If it's a real person and they really appear to be a scientist, then you can find their credentials, then you can trust them. And then also realize that reasonable people may disagree, and so scientists may have different opinions, and that's okay, right? Like that's part of the scientific discourse. So yeah, so I mean, Twitter's good, but it's also bad, and you just need to be alert and be aware, and just use it like you would use any other tool. A jackknife is great for whittling, and you can also cut your fingers. So you use it appropriately and try to be safe.
Well, I'll make sure I be careful with that jackknife. So I'm going to combine a couple of questions, so it's a little long.
Sure.
Regarding food service. So food service, of course, involves service, interactions between servers and customers and amongst customers. We will face this big time in the winter with either indoor or no restaurants open. What do you think about that? And what about cautions in the kitchen? Are there rules about mask use in the kitchen as there are in the cohort of table servers? And I'm going to tie this in with a question about why the virus doesn't appear to be transmitted through food like other viruses like gastroenteritis are.
Yeah, so let's take the last question first. So the short answer is I'm very careful to try to say that I don't want to say the virus can't be transmitted by food. What I will say is we don't have evidence that the virus is commonly transmitted by food or food packaging, right? And so it may be possible that the virus is spread by food, but that does not appear to be the overwhelmingly primary way the virus is spread. And again, we're getting a little bit out of my expertise as a food microbiologist, but I'll talk for a minute. So for the virus to infect a cell, that cell needs to have a receptor that the virus will bind to. And we know that this particular virus binds to something called the ACE2 receptor. And ACE stands for something that's long and complicated and scientific that I won't try to remember at this point. But then there also needs to be a subsequent molecule that needs to be there with the ACE2 receptor to help the virus bind and then actually get inside the cell. And so the question is, do we have ACE2 receptors in the lungs? And the answer is yes. Do we have ACE2 receptors in the esophagus, in the stomach? Yes, and or maybe not in the stomach, but maybe in the large intestine or the small intestine. But the question is, can the virus actually get there? Can it disassociate from the food? Can it get to the cell wall? And can it bind to those cells, and then can it infect and invade those cells? And the short answer to that question is we don't know for sure. But it's also important to indicate that these coronaviruses are different than, let's say, viruses like norovirus. Norovirus is what we call a non-enveloped virus, and not the virus, the envelope doesn't protect the virus. The envelope actually makes the virus weaker. And so non-envelope viruses like norovirus are much more readily able to pass through the acidity of our stomach and then eventually invade, as opposed to these coronaviruses. Coronaviruses, again, primarily seem to be spread by air. We do see when people get sick with coronavirus, one of the symptoms can be diarrhea, and we do see viral RNA in the feces or in the diarrhea. And so there's been some suggestions about fecal transmission, but again, as far as we know, that's not the primary way that it happens. We did see with the original SARS, there was an outbreak in a apartment building that had improperly vented sewage lines, and so people were flushing their toilets, and that was causing aerosolization of the virus, which other people inhaled, and the virus was spread that way. In terms of the best practices for restaurants, we're still learning this, right? We think that ventilation may be important, and so that's why outdoor dining is probably lower risk than indoor dining. But of course, maybe we're not going to be doing outdoor dining in January, right? At least not here in New Jersey. I'd say everybody, has to try to make your own best decisions. I'm still not ready to go and do outdoor dining or indoor dining. I'm trying to patronize my local area restaurants by giving them takeout business. But I'm just not willing to take that risk. I mean, I'm not in a high risk group, but I don't have any comorbidities. But I am almost 60 years old, and I know that definitely places me at higher risk. But yeah, I mean, servers wearing masks, that's good. Patrons wearing masks, except when they're eating, is good. Kitchen staff wearing masks is good, but I know it also can get really hot in those kitchens. And so figuring out what's the best practice, it's a challenge. And we don't have all the information, and we don't necessarily know the best practices, which is, again, part of why our group was funded on this COVID-net project to hopefully get some answers. So there's still a lot we don't know, but the good news is we're continuing to think and learn and hopefully make better decisions over time.
Thanks, Don. We have one last question, and at the end, everybody, there will be some information about how to contact Don or learn more about his work through his podcast. So don't despair if your question didn't get asked. We'll find a way to get that answer for you. So the question is, if you had the power to change how science is communicated in media, what would you do? What would you tell people to do?
Oh boy. One thing that I would absolutely insist upon is if you're a reporter and you're reporting on a paper from the literature, please give me a link to that paper. It might be behind a paywall, but it would really help me that I don't have to go Googling for what I think the title might be and what the author's name is to try to figure out what the actual study is that you're talking about. And then, so that's kind of my number one wish. That's a little bit kind of petty and picky, but it would really help. And I would say too, we need to promote science journalism, right? Like there is a specific kind of journalism called science journalism, which is people that understand science and understand how to talk to scientists and understand how to write good articles. And so I would love to see science journalism be a well-paying, lucrative career, and we should reward and praise science journalists who get the science right. And then I would say maybe as part of that, we also need to do a good job of educating scientists how to talk to journalists. I mean, because I've had a cooperative extension mission my whole career, I've always considered myself part of my audience of the people that I talk to is the news media, and I use the news media to reach people in the general public. And so educating scientists to how to talk to the news media and giving them training. I mean, it's been years ago, but I've done media training, and I continue to hone my craft as I speak to reporters and I see what sound bites work and what sound bites don't work. And I appreciate the reporters that, I mean, some people are on a deadline, and I understand being on a deadline, but it's nice to work with magazine reporters who will just talk with you for a half an hour and may get back to you with a fact checker, may get back to you a month later. I like that sort of luxurious timeline, but I also understand the person on deadline that needs a comment on a story by 1 p.m. today, or it's not going to make it into the final story. And so, but again, I think part of that is training scientists to be able to deal with all of those kinds of ways that information comes at them, and again, make it something that, I mean, consider it, again, part of my job. And it's captured to a certain extent in my CV. Hopefully it's been reflected in my promotions and activities over the years, that I really like to engage with the news media. And again, I consider it part of my job, and I hope others would do that as well. And that would be a respectful and worthwhile thing. It would be considered a respectful and worthwhile thing for a scientist to do, rather than something, you know, that sullies them or dirties them or makes them be less of a scientist. I want people to think that talking to the news media makes you more of a scientist, maybe even makes you a better scientist.
Well, Don, thank you so much. It's a wonderful ending to the Science Cafe, which is an opportunity for scientists to talk to the public in an informal setting, albeit we're virtual this year. So at this point, again, thank you, Don. Thank you to the attendees. I'd like to hand it over to Brian McGonigal. Brian?
Yes, thank you, Mary. Thank you, Don. I'm going to show a slide, gives you some information. When you close out of this event, if you could, please just complete the survey that pops up. That'll help. And I will share the slide.
Yeah, I would say we just recorded an episode of Food Safety Talk today, and we spent the first half of the episode talking about COVID-19 and hockey, and in hockey leagues, because my co-host Ben Chapman is a big hockey player, and he's talking about what they're doing to manage the risk of COVID-19 in the North Carolina Hockey League that he plays in. And if you don't have 2 hours about twice a month, please do check out Risky or Not, which is a short podcast, comes out 3 times a week, less than 15 minutes. And we've had a number of topics on that podcast relating to coronavirus as well, although it's mainly focused on food safety, as is Food Safety Talk. Oh, and by all means, reach out to me on Twitter. If you didn't get your question answered, reach out on Twitter, or you can look me up on the internet, send me an email. I'll do my best to answer any questions that didn't get answered, didn't get answered today.
Okay.
Go ahead, Brian.
Hey, thanks, everybody. Thanks for attending. Have a great day. We'll be in touch.